Sir, how about treating a person with the sugar? This becomes a challenge for any doctor in terms of anything, because a person who is living with sugar, or the high pressure BP and all these things, blood pressure. So these two majorly becomes a challenge even at the time of treatment as well, because they are already taking some other medicines, and this medicine also looks like your treatment or the surgeries looks like very high intense.
Yeah. So blood pressure is something which is usually very easy to control, along with some lifestyle changes. I'll keep coming back to lifestyle because that is the key to a healthy life. Lifestyle.
Right.
I'll keep talking about it. So blood pressure can be easily controlled with lifestyle, some moderate exercise, just walking. Brisk walking is good.
Okay.
Moderate your salt intake and take the medication which the doctor prescribes. Blood pressure is very easy to control and no ill effects because of that following control of blood pressure. But uncontrolled blood pressure, it damages the heart, the kidneys, the eyes.
Oh.
So uncontrolled blood pressure is a bad thing to have. Diabetes, slightly more difficult problem to deal with. Their lifestyle extends to not only walking, perhaps also changing your food.
Okay.
Dietary habits. So go back to home food, avoid refined sugars. And refined sugars, I think even people who don't have diabetes, they should avoid or minimize. For example, drinking sodas or eating too many sweets. I think it is something one should cut down on, because refined sugars are what we may call empty calories. They only can cause you bad and not good.
Okay.
So diabetes also, we like to control it before we do these procedures. And diabetics have their own set of problems. Like blood pressure, they affect the heart, they affect the eyes, what we call diabetic retinopathy. They affect the kidneys, what we call diabetic nephropathy, where patients can go into renal failure and go on to dialysis. We see a lot of that because we work with dialysis patients also. And then of course they also develop vascular disease,
Right.
where the blood flow to the leg is affected. And sometimes even when the blood flow is not affected, even then they get foot deformities, they get ulcers on the feet. So what I tell my diabetic patients, take care of your feet like you would take care of your face. So your feet should look as good or even better than your face.
Okay.
Because then they are safe.
Right.
So no cracks, don't keep them dirty, don't walk barefoot, cut your nails properly, keep them moisturized and healthy. Keep looking at them like you keep looking at your face in the mirror to see, is the hair in place, is there something on the face. So look at your feet, is there any blemish on the foot?
Right.
Fix it. Take help. And vascular patients, many of them are diabetics. So they have a combination of diabetes, at-risk foot and decreased blood flow.
Okay.
And these patients tend to have the worst type of wounds to manage. So we have now actually taken in our team a diabetic foot surgeon who has trained in plastic surgery and then who has trained in diabetic foot care.
Okay.
So that girl is now part of our team. I mean, I'm saying girl, but she's a fully trained super specialist doctor. And we are now actually able to treat these foot problems in a much better way.
Okay.
Especially for diabetics.
Right. And nowadays it has become a regular thing to see cracked legs.
Yeah.
From young people to the old people.
So barefoot walking is what has a lot of impact on the health of feet.
Sir, not to disturb you or distract you, but same time, there comes the other matter that some of the doctors and some of the people are advising to walk barefoot.
Barefoot for a short while on the grass.
On the grass. Okay.
There is a group of people who believes that you should live as nature intended you to live. But then we are not living totally in natural surroundings.
Correct.
So if our surroundings get modified, we also need to modify.
True.
It's like people talk about, oh, my ancestors, they used to eat so much of ghee. They never had a problem. Why should I have a problem? But then you are not living the life that your ancestors were living. You are living a different life.
True.
You modify your life according to the way you live.
They used to live in the nature. We are living in a nature which we have controlled.
Yes. So now this is nature for us.
Correct. It is concrete jungle. They lived in the original jungle.
So even there I would say walking barefoot on the grass for a short while is good. But again, diabetics I would say no.
Okay.
Because diabetics also develop damage to their nerves causing neuropathy, where the feet have no sensation.
Oh.
They can injure their feet and not even come to know.
Okay.
For them I say even in the house use footwear. So even in the house some toy might be lying around, your grandchild's toy or pencil or sharpener or anything could be lying around. You step on that, you won't even come to know. because there is no sensation.
Correct, correct.
You get cut with a blade which is lying there, you won't come to know.
Right, right.
And only later if somebody sees, oh, there is a wound. And by that time it is quite late.
Absolutely. And it has become very normal nowadays.
So similarly, walking on the grass, there might be a stone that you step on.
Right.
There might be a nail that you step on. So for diabetics, I think it's not advisable to walk barefoot anytime.